Welcome back. The federal government is being urged to put an end to online application, which is being described as cruel and inhumane. The Commonwealth Ombudsman is now investigating the integrated assessment tool, but advocates say the investigation may not be enough. For more, I'm joined by the Chief Executive for MND Australia, Clare Sullivan. Clare, could you just start off by explaining what IAT is and how it's used?
Sure. IAT is essentially the algorithm that underpins the assessments for the new aged care funding program from the Commonwealth. For people with MND, it's the supported home program. So it's an automated assessment for funding decisions for social service programs.
So what was the process before this was introduced?
The process prior to this had assessors within the department, so public servants who would draw on a range of clinical evidence and information from people who are going through apply for funding support. It is now an algorithm. We aren't really sure. It's a very opaque system that's been set up. There have been hundreds of complaints made to the Commonwealth Ombudsman, which is why we welcome the fact that they're investigating the complaints, and we're hoping that they will also investigate the use of an algorithm for something that really is a decision that needs to be made by a human.
Yeah, in your experience, how has the algorithm-based tool impacted people living with motor neurone disease?
People living with motor neurone disease, they lose the ability to use their bodies. They lose the ability to walk, to use their hands, to talk, to breathe, to swallow and chew. What we're seeing is people overwhelmingly want to stay in their homes, and due to the rapidly progressing nature of the disease, it's really difficult to stay in your home. You need a huge range of support, including equipment, home modifications, allied health and personal care. Under the new supported home program, people are worse off. Funding packages have been reduced, and there's a need for people to co-contribute, which is putting further strain on family budgets. We're also seeing the processing time for people receiving these assessments blow out dramatically. For people with MND, they generally have 2 years to live from the point of diagnosis, and the assessment can take 9 months as assessed by the government as a medium priority. We're seeing people overwhelmingly with lower packages than they would have been if they were in the old system before the reforms came in. So people with MND are worse off, and I would anticipate that this is reflective of the broader 65 and over population in the country.
The Commonwealth Ombudsman has launched an investigation. Is this adequate, or do you want to see more done?
Look, we've seen a whole lot of political pressure on the government. The system isn't working. It's not working for people with motor neurone disease. It's not working for older Australians. The whole system needs to be reviewed and overturned. The efficiency that the departments are looking for gaining out of using algorithms and automated assessments is not resulting in faster processing time. It's not resulting in any sort of economic or financial efficiency. It's getting worse. So I would encourage the government to review the entire system. And certainly from what we're seeing in the MND community, we saw the reforms being pitched that everyone would be better off, and overwhelmingly we're seeing people are much worse off.
Clare Sullivan from MND Australia.